A new poll from Emory researchers is giving us some insight on how Americans feel about changes to public health policy. We're talking everything from vaccinations to children's nutrition benefits. Here to talk more about it is author Stephen Patrick. Welcome to the show, Stephen.
Hey, it's great to join you again.
All right. What are some of the policy changes you looked at in this poll?
Well, over the last 6 months, we've seen pretty profound changes. Everything from committees that review vaccines for CDC being disbanded to changes to newborn screening and committees that advise that. So we asked Americans, what do you think about these changes? And largely what we found was Americans weren't supportive of the things that we've seen, and some of them have caused Americans to lose trust in some of the systems that we have.
Do we know who was surveyed?
Yeah, we surveyed a representative sample of the U.S., so all Americans. We use data from CDC to make sure that it's representative of the U.S., so it's just like a poll.
Yeah. What did you find out about the support for these moves?
Well, one of the things that, the motivators beyond the ACIP, this is the committee that reviews vaccine science for CDC and makes recommendations. We know that Secretary Kennedy removed all the members and replaced them. And part of that drive, part of the justification was to promote more trust. But we found that that move caused about half of Americans to have less trust in that committee. One of the things that we look to is by who folks voted for in the last election. So we found that, even among folks who voted for President Trump in the last election, a majority of people did not increase their trust in that committee after this move.
Yeah. Were there any issues that were less unpopular than others, maybe?
That was one that was more unpopular. I would say the least popular thing was safe sleep support. So for about 30 years, the federal government has had a program to ensure that infants are placed in safe sleep environments. We know it's the third leading cause of death for infants is sleep-related deaths. Only about 16% of Americans thought that it was a good thing that the federal government does not promote safe sleep programs any longer.
All right. We were just talking about vaccines. What did the poll say about the change in vaccine policy?
The change in vaccine policies that we've seen, both in terms of committees that advise CDC, as well as recent COVID vaccine changes in the federal government, have largely not increased the trust of Americans. And for a big chunk of Americans, about 50%, it's actually decreased trust in federal recommendations for vaccines. And this is troubling because we rely on these federal public health systems to provide recommendations for all of us. It's what insurers and state governments rely on. And so when we start to lose trust in these pretty core functions, it becomes worrisome. Right. We would hope that many of these things that we see in terms of science would be backed by research and science. And what we're finding is that many of these actions have not been backed in science and that they're not backed in public opinion either.
Yeah. The government started allowing states to restrict the kind of food that people can buy with their SNAP benefits, and people were mostly okay with banning junk food. What's the big takeaway on there?
Yeah, that was the most popular thing that we polled on. This is around SNAP benefits that have sugary foods. We found bipartisan support for this action.
Okay. Stephen Patrick, thanks so much for joining us. Thanks so much for your insight.
Great to see you.
All right.